I see Dr. Lenny Da Costa waiting in the wings. Dr. Lenny, who's also become like family, you know, since this COVID thing. Whenever I need somebody to present, I'm always, he's my go-to place after Joe and of course after Vince. Vince, thank you so much for joining the call. I know you've got some personal issues, but thank you. So Dr. Vince is also on the call. Dr. Lenny, the floor is yours.
Thanks, Dr. Nasiba. I'm going to share my screen. I have a longish presentation and I'm trying to finish it in the time allotted to me. But just before I start, I think we are discussing also today a lot of the wax injuries that you guys are seeing. Let me be, I've been talking to you, Dr. Nasiba, over the last few days, asking you for some details about the wax injuries. So I've done my own research and been using a certain protocol. The mainstay of treating wax injuries is the same as treating COVID acutely. Only thing is it's a little different how you do it, because after reading a lot of data that has come out both in the functional medicine area as well as in mainstream medicine, it is that crown protein that is causing the problem even in wax injuries. And they have shown the crown protein in people who have had COVID 1.5 years back, still causing problems today. They have isolated it. So it can last for that long as well. And we don't know how long it's going to last. So as I go through the presentation, I'll show you melatonin is one of the mainstays of treatment. And you'll understand why when I just show it to you. We've used it in very advanced cases in ICU patients, and it has worked. So just let me get started. So my topic today is going to be the IVs that I've used in treating COVID and the IVs that I currently use in treating COVID injuries in a lot of my patients who come to us. Yeah. So this was a protocol that I'd like to share. This is a protocol that I won't give it right at the beginning, and I'll repeat it at the end. This was a protocol that we've used with people who were seriously ill in ICU setups. We've used glutathione 600 milligrams IV twice a day. And so I do it a little differently, like I teach all my trainees in my workshops on how to do this glutathione. It has to be in your body within 15 minutes of reconstituting the glutathione that you get from your pharmacy. Then you have 25 grams of vitamin D, depending on how serious you were. It was once a day, twice a day, or 3 times a day, every 8-hour week. I've given one patient who had SpO2 levels of about 85, even after 10 liters of oxygen, 4 times a day. That's 100 grams a day. On day 6, he was out of the ICU. All right. Then we've always used 9 to 12 milligrams of melatonin to start with, and I've pushed it up to 20 milligrams. Vitamin D 60,000 IU every day were given to these patients. We've used zinc magnesium supplements orally, B12 ALA orally because I couldn't get ALA IV here. And steroids, of course, the hospital was using it the way they felt necessary. Now, these are people who actually requested us, fought with their doctors, and we got the vitamin C and the glutathione to come in and be used in the ICU settings. Now, let me explain to you first what glutathione does in a brief manner. So what happens is there was a lot of data that was initially out which said that, and that's how I started using it in my protocol, that low levels of glutathione, the chances of virus replications were much higher. Then they also said later on that glutathione restoration would inhibit viral replication and decrease viral load as well. But what would happen is we were using glutathione IVs much after all this. It was the patient had already got a cytokine storm, was going through a cytokine storm already in the hospital. So the first part of that viral replication and all that was not really in concern for us. But we could have used glutathione much earlier to prevent all of this happening as well. So glutathione acts as an antiviral, anti-inflammatory, anticoagulant agent in COVID-19 patients, and it inhibits viral replication at different stages of the viral life. Now, glutathione prevents subsequent massive release of inflammatory cells in the lungs, that is specifically during cytokine storm. This is where glutathione comes in handy. And you need to use this on all your patients. For wax injuries, I still use it once or twice a week with vitamin C. I give glutathione first and then follow it with vitamin C because it does the same job. It doesn't allow the crown protein to do what it does, create the inflammation in any part of the body, right? So this was one of the first official, the manufacturers of glutathione in our country came out with this very early. And I found it very interesting because then I started doing my own studies and I found a lot of this was correct, did a lot of research. So it reduces the oxygen species or the reactive oxygen species, which you see commonly in COVID. It inhibits the ACE activity. So you don't have the upregulation of ACE2. It decreases reactive oxygen species production, and it inhibits nuclear factor kappa B. So all anti-inflammatory effects here. Then it is also understood that people who are in severe COVID have very low levels of glutathione. So, or they do not have that glutathione being, so if you understand how glutathione works, it's reduced glutathione that works. When it works, it gets oxidized. But this whole conversion of oxidized glutathione or glutathione disulfides to glutathione is a tightly controlled hemostatic activity within the body. This gets affected when you have COVID. So you need to give glutathione from outside by IV so that you can increase the endogenous glutathione, and that reduces a whole lot of symptoms in COVID-19 patients. And that is what we thought, and we started using it. Okay. Now, there were a lot of studies that came out afterwards, a lot of papers that came out afterwards which showed that glutathione worked in most of these cases, specifically addressing the cytokine storm. You had a number of them. You needed to give it together with, selenium and other things as well. A lot of them came out, but this was much later. This was somewhere into 2021 probably, where we started seeing these papers coming out. This one was one of the earlier ones that I had read. And so let me now go to the second IV that I use, and this is my go-to IV. This is the Savior that has saved so many of my patients. I've had one 28-year-old boy who was lying in the ICU for 17 days before we intervened, and on the 30th day he was out. He was really serious. The doctor had given up hope. He was told they had told the parents that he's not going to survive. So some of those cases, I thank God that vitamin C did work on that. So when COVID-19 actually was ranging here in May 2020, we were wondering what to do. And we thought vitamin C would be one of those because we've been using it in so many other antiviral conditions. So we started looking at it. And today, while I'm talking about vitamin C, I'm going to focus on what are the mechanisms that help you, that vitamin C does to ensure that COVID-19 doesn't, kind of kill the person. And that is very interesting because if I give you that data, you'll probably understand how important a molecule this is in the fight against COVID-19, especially when you're putting a patient or a patient is admitted in the hospital. See, as long as the patient is not admitted in the hospital, we can do a whole lot of things outside. But once he's admitted in the hospital, there's a very limited number of things that the hospital does for that patient anyways. And so here is a molecule that you can use on a regular basis if you know why you're using it. So let's look at that. So there has been evidence that oral vitamin C, 2 to 8 grams a day, could reduce the incidence and duration of respiratory infections. Even before COVID came in, this was there. Now, intravenous vitamin C, 6 to 24 grams per day, was shown to reduce mortality in intensive care unit and hospital stays. And there are a number of studies on this, or a number of papers that have come out on this. And the time on mechanical ventilation for severe respiratory infections. So I had actually used vitamin C in a case of multi-drug resistant TB who was practically on a ventilator in a very in a very respected corporate hospital in Mumbai, because a friend of mine there, who was the head of the department, requested me to try and give them the protocol for vitamin C. And so we did use 25 grams 3 times a day for that patient. The patient moved out of the ICU in about 6 days. Post that, I know that a lot of intensivists in the country were using it and had gone through a number of papers that said that you could use it for infections, specifically those that are not responding to any kind of antibiotics in the ICU setting. So this was what was being used. Anywhere between 6 to 24 grams was being used regularly. So we said, why not use it for COVID as well and see what happens? And so let me give you a little bit of introduction as to why. We all know it's a water-soluble nutrient. We all know that it is synthesized from fructose in plants, but in animals, it is synthesized from glucose. Most of Earth's primates, especially man, lost our ability to synthesize vitamin C from glucose 40,000 years ago because we lost the use of that final enzyme that disappeared from our bodies called gulo or gulonolactone oxidase. That's a full form for it. This is required for the synthesis of vitamin C from glucose, all right? And this happened probably due to some gene mutations 40,000 years ago. That's when we lost the ability to do it. Now, and so also a lot of other primates like the monkeys and the apes. So most of the species were therefore dependent on vitamin C coming from their food. Now, primates are dependent on adequate supply provided by fruits and vegetables on a daily basis. So gorillas, which require about 4 grams a day. So gorilla is probably slightly in weight, slightly higher than what man is. But let's look at a monkey. A monkey weighs 7.5 kgs, an average of 1/10 of a human being. A monkey requires 600 milligrams a day of vitamin C to be healthy and survive. Unfortunately, our average requirement is 90 milligrams a day. That's what the official requirement for men, and 80 milligrams for women is what is recommended, all right? And this is to maintain a normal plasma level of 50 micromoles per liter. So this barely helps you not to get scurvy. It doesn't do anything else that vitamin C is supposed to do. 200 milligram of daily dose will provide only 70 to 90 micromoles per liter of vitamin C in your plasma. 1 to 3 grams every 4 hours. This is the highest dose that you can take orally, because then sometimes it starts giving you the diarrhea and the runs. But some people who tolerate it, they go up to even 6 and 12 grams. But this dose of 3 grams, 1 to 3 grams, gives you about 220 micromoles per liter of plasma concentration of vitamin C. But if you give the same 3 grams IV, it raises the plasma concentration 10 times. So it goes up 10 times. Same dosage, but given IV, the levels go up by 10 times. So therefore, IV is something that you would want to use if you're handling very serious patients. Higher intakes of vitamin C are likely to be needed during viral infections. So 2 to 3 grams required to maintain normal plasma levels between 60 and 80 micromoles per liter. This is the minimum that you need. So if somebody is sick, you need to give 2 to 3 grams of vitamin C orally regularly. This is what has been there. We know this. A lot of the data that has been on vitamin C tells you this. Now, in hospitalized patients, various papers have come out and shown at various places that people who are in hospitals, especially undergoing surgery or are in the ICU settings or are seriously ill, all of them have vitamin C levels less than 11 micromoles per liter. And until this vitamin C levels go up, these patients, their prognosis is generally not really good. Okay, so this was a stark statistic that you can see, and probably it was this reason why very early cases of high number of deaths of COVID-19 did take place. The UK's National Diet and Nutritional Survey, based on cross-section of the UK population, reported that 4% of 65-year-olds and 40% of those institutionalized in care homes have vitamin C less than 11 micromoles per liter. Now, less than 11 micromoles per liter is vitamin C non-existent. So this is probably the reason why many of the elderly folk were passing away, especially in the care homes in the UK. Now, in pneumonia, vitamin C has been shown to work really, really well. The meta-analysis has indicated a reduction of risk of pneumonia with oral vitamin C supplementation, particularly in older patients with low dietary intakes. Another prospective study of 19,357 men and women followed over 20 years found that people in the top quartiles of baseline plasma vitamin C concentration had 30% lower risk of pneumonia. So the fact that pro-inflammatory cytokines, cytokine storm, is the one that causes most of the problems in any kind of ICU setting, especially when you have a severe sepsis or anything, and in COVID-19 as well, it's a cytokine storm that finally kills you. Now, these cytokine storms are actually activated by something known as NLRP3 inflammasomes. Now, the ability of a melatonin, and I said this before, then that's why I put this slide here. This is not IV. You're taking oral melatonin, and we try and give you as high dose as possible. Melatonin inhibits NLRP3 inflammasome. Melatonin inhibits NLRP3 inflammasome. So anything to do with cytokine storm, you don't want this patient. So right from the beginning, this patient should be, when you diagnose him, should be on good high dose of melatonin, minimum 10 milligrams a day. Personally, when I had my COVID, I did do it with IV vitamin C, melatonin, and my entire protocol that I just showed you. Because my lungs were totally affected and the CT score was 20/24 and I was asked to get admitted. I didn't. I treated myself at home. 10 days later, I was absolutely fine. That's my personal, I was sick in the month of October last year. All right. So melatonin is a huge, huge molecule. It works on the NLRP3 inflammasome. And how was this kind of discovered was because somebody did a study on this. They realized that a lot of the pregnant women didn't die. They may have got COVID, but they didn't die in the hospital, in the Zhongnan Hospital of Wuhan University. Why? Because in the third trimester of pregnancy, melatonin secretion is normally very high. Okay, you have high melatonin in pregnancy, but in the third trimester, it's very high. So none of them die. Now, melatonin inhibits NLRP3 inflammasomes. It is known, it also has very important function as far as the circadian rhythms are concerned. And today, a lot of people are using melatonin to target NLRP3 inflammasomes so that the people don't have the cytokine storms hitting them. In post-COVID jabs, it actually works at minimizing the effect of the spike protein in various tissue areas or sites by enhancing the effect of certain receptors, which kind of don't allow the spike protein to do what it does, create the kind of inflammation that it creates at the local area, all right? Now, vitamin C also does this, my dear friends. Vitamin C also does this. It inhibits NLRP3 inflammasome as well. And this has been shown both in vivo and in vitro. It doesn't cause any cytotoxic effects nor cell death, all right? So giving high doses of vitamin C to COVID-19 patients, especially those who are in hospitals or who have cardiovascular and hypertension comorbidities, is something that you need to do as a must if you want to save these patients from dying. I think 90% of the people who have died because of COVID could have been saved if everyone was given IV vitamin C. Now, this was a paper that I read last Jan, and I did my first one of the free masterclasses that I do for my trainees because I wanted them to understand how to use vitamin C to treat their COVID patients. And the second wave was just getting started when we did this. And here, I understood 7 other different mechanisms of vitamin C. And because of lack of time, I'm not going to go into details, but I just show you the diagram which kind of tells you everything. It decreases nuclear factor kappa B signaling. It decreases neutrophil extracellular trap formation. This is a different pathway by which a lot of your tissues are damaged. And that's where you have multi-organ failure and people die. It decreases the viral entry. Always remember that. It decreases the viral entry. So even if you have post-COVID patients and patients who have had their vaccine jabs, I give all my patients one vitamin C, 25 grams with about 600 to 1,200 milligrams of glutathione before that as a push or as a very small drip. But vitamin C as a 1.5 hour drip, 25 grams, every week. All of them get it every week, and they're absolutely fine. Nobody wears masks. It doesn't look like that we are in a pandemic here, though we have a few official restrictions still in place. Then it decreases reactive oxygen species. It reduces the oxidative stress. It increases the adrenal function. So if you remember, one of the things that works in serious patients in hospitals is steroids. That's the only thing that the hospital uses. Here, vitamin C enhances the effect of cortisol production in these conditions, all right? And it increases the lung epithelial barrier, preventing the SARS-CoV-2 virus from entering your system and destroying it. So these are the 6 or 7 different ways that vitamin C actually works in COVID-19. And is there evidence? There are a lot of papers that have come out, a lot of studies, but the first one which was discredited, and because of that they say vitamin C doesn't work, is the one that actually tells you that it works. And I just want to mention this. The Citrus Ally trial, where they used vitamin C, what they did was they used 50 milligrams per kg for every 6 hours for only 4 days. It was not for 4 days. And what happened during those 4 days, and look at the last para there, there was a decrease in mortality rates, went down by 81%. So what more do you need to tell you that there is something that can help you prevent death in COVID? This was and they stopped after 4 days. And obviously, there was no difference between the study group and the other, because the moment you stop it without getting the patient out of it, the patient goes back into it. So if you look at this particular trial itself, it gives you a lot of information. Then the first random control trial that was done in Wuhan itself, where 54 ventilated patients were given vitamin C. After 7 days of treatment, the requirement of oxygen in the patients the external oxygen in the patients who were taking, or ventilation requirements, went down drastically in those who were taking vitamin C. On day 7, interleukin 6, which we are using a whole lot of IL-6 inhibitors, and one of them, the best one, in fact, Dr. Nasiba spoke about was Nigella sativa, black seed. We get it, beautiful oil here in India. That works as well as an IL-6 inhibitor. Here, vitamin C, on the 7th day, IL-6 levels went down drastically in the people who were given vitamin C. This is the Wuhan trial that is telling you that. And this was very early, and we have not wanted to look at it and not bothered to use it in hospitalized patients. Then you have and there were no adverse effects reported in these patients, all right? But the trial initially was designed for 140 subjects, but since their cases were going down when they did this, it was underpowered and had only 50 patients. And that is one of the reasons why it's been discredited. But it gives you evidence to tell you that, hey, listen, vitamin C works, okay? Now, there are so many others that are going on. There's one that goes on as high as 10 grams a day for vitamin C intervention study in 500 adults. I don't know if this has come out. I've not been able to check on this. There are many others. And so FLCC also came out very early, and I don't have their recent data with me, but they also came out with 6 grams per day intravenous vitamin C, which was used by some of the hospitals in India. And even there, they had fantastic benefits where the death rate went down by more than 50%. So when you look at most of these papers that came out on use of vitamin C, you will realize that most of these studies have a low dose of vitamin C, and they were for a short duration. When we did, and our experience, and this is not only mine, I have a whole group of doctors who worked with us on this in various parts of this country, and our country is huge. And we probably treated thousands of patients in hospitals with this, but it has never been brought out because people don't want to talk about it. We're just happy treating our patients. And we don't want to fight the government here, because at least we get ivermectin off the shelf. We get so many other things off the shelf. We don't want to be in a situation that South Africa is, or Europe is, or America is, where they don't get this stuff and where patients can help themselves out. So we are keeping quiet and we're just treating our patients and doing our job. But we'd like to show you how it works. 25 grams a day minimum has to be given for 7 to 10 days. I give it to all patients who have any lung infestation or lung involvement. We give it to all these patients. Every patient of mine has glutathione and vitamin C if they have any kind of lung involvement which is seen. So with that, within 10 days, they kind of resolve. By 15 days, even if they're in the ICU, they're out. So this is what we do generally. Is it safe? There's a lot of safety data that has come out, but I'd like to go to just this one. Okay, so just one thing, you need to understand that you can't give it if you have G6PD deficiency. You can't give it to people who have hemochromatosis or thalassemia. These are the 3 conditions you will not give vitamin C. So G6PD is something that you can't give, thalassemia you can't give, hemochromatosis you can't give. So you need to rule out these 3, and we do. And the easy way to rule out whether you have a G6PD deficiency, just ask the patient, if he or she has got, of course, you need to do it. If you're in the hospital, you can do it, but some of them may not be able to do it or get to the lab before you want to do it. So just ask if they've got peanut allergy. If they've got peanut allergy, there is a lot of likelihood that they have G6PD deficiency as well. And so I want to show you the safety aspect of this. This is a prospective cohort study of 85,557 women with no history of kidney stones, with 1,778 incidences of kidney stone over 14 years of follow-up, reported, now this study reported that vitamin C was not associated with the risk of kidney stone development at all. All right, so there are many others, there's a lot of literature to show you that vitamin C doesn't cause kidney stones. It doesn't cause any harm. All you need to make sure is the patient is not G6PD deficient, doesn't have thalassemia, and doesn't have hemochromatosis. That's it, and you can give it to everybody else. Again, this is my protocol. 25 grams vitamin C once, twice, or thrice a day, even 4 times a day, and everything else that goes with it. Orally, we give ivermectin, we give doxycycline, that is initially. We give vitamin C orally, we give vitamin D orally, and we give quercetin with zinc orally as well. We've also used black seed oil with curcumin in a number of patients just before, when we realized that they were getting into, before the doctor was trying to put them on steroids. We also added black seed oil with curcumin, and that worked wonderful. So for those of you who, that's my email. For those of you, I know there are many doctors who are there on this roundtable. If you want my exact protocols, how I mix my drips, please send me a mail and I'll be happy to give it to you, because I want you to help as many people as possible in your area. This is one way that you can save people from dying. And that's our job as doctors, my dear friends. Please go out, touch lives, and save lives. Thank you so much for your patient listening. I'm willing to take whatever questions you have. And Dr. Nasiba, thank you again for giving me an opportunity to kind of come and share what little I know.
Thank you so much, Dr. Lenny. There's definitely not little that you know. You're such an inspiration. And I love your passion for vitamin C. And also I knew, that's why when I was talking about it, I did say that you're going to be, I had a feeling that that's the way you were going to go. Thank you so much for your input always. If I have a question, and if there's anybody else who wants to ask a question, please raise your hand. Make sure that your camera is on so we know who you are, and make sure that your name is full at the bottom so I can see who you are. So my question is, it's not specifically about vitamin C, but are you seeing any Omicron strain COVID milder cases in India?
So we have got very, very few Omicron cases, most of them traveling from overseas. See, our counts have gone down dramatically. The last time we interacted with Dr. Nasiba, I just told you that the government had said we are practically in a kind of a endemic state now. Yeah, we are no longer in that pandemic state. We have very few cases, but the government is like upping the ante, and they want to give the booster. We have not started boosters here. The government has officially not come out with it, but state governments are saying if you want to take a booster, you can. That's because they have managed to do about 50% of the country double vaccinated. But more than that, many people who have gotten infected already are kind of showing that seropositivity or whatever. And most of these, and the cases have just generally kind of plummeted. In fact, in Goa, we had 3 COVID care hospitals. We've just got 1, and there's nobody in there. The number of cases that are admitted are, about 15 or 20. Nobody's dying. We've hardly had any deaths in the last 1 week. Yes, countrywide, we are a huge country of 1.3 billion, and we do have a few deaths happening. Maharashtra, which is where Bombay is situated, has got the largest number of Omicron cases, some 29 of them on the last count. But they are slowly rising, but we are looking at it, and we've not seen a single Omicron case being reported as dying or having reached the hospital.
Well, the big difference between India and South Africa is the percentage of vaccinations, right? And I think that that's one of the reasons why it was such a big thing to talk about it here. Because like Dr. Joe was saying, she's got this patient now who she admitted. If we go back to pre-pandemic, as doctors, we need to always remember that even from the same illness where it's generally mild, we are going to have those canaries and those rare ones where somebody is going to be admitted to hospital and die of the flu. And then the person will end up in ICU and you'll say, I did everything through the kitchen sink, and then the person died. Now, suddenly, one person dies and they're like, oh my God, everyone's going to be dying of this strain. You know, and I'm so glad that you mentioned, I saw on one of your slides, and also somebody, I think Dr. Mansoor mentioned in his in the comments, that he's using what they always use for the flu to treat COVID, because it is like a flu-like illness. And vitamin C has been used for years, and all the supplements I spoke about have been used for years. And we need to just remember that. And I love the fact that you're so willing to share your protocols. Misty, you have a question for Dr. Lenny?
Yes, I do. Thank you so much, Dr. Lenny, for, I really appreciate your use of the science and clinical data, the trials, because in working with my colleagues here, a lot of times they say, oh, this is just anecdotal, oh, it's just your experience. And the experience does count, because from the experience, we can build the research trials required to prove and disprove on a large scale. So I really do appreciate your time of sharing. My question is, and the challenge has been, persons, I don't have at this present time access to IV. I don't do IV therapies myself. So I deal with a lot of oral medications. And vitamin C has been one of those, inclusive for me, that is, you want to take it, you love to take it, but your stomach, but the GI. And the GI meaning the heartburn, the nausea, the bloating, and so forth, less the diarrhea. How do you navigate around that? I know that there are buffered vitamin C preparations with, I think it's the calcium carbonate that can be used. Can you speak to how absorbable those are? So they're more tolerable on the GI. You can get to 5 grams, a lot easier orally. But how much is absorbed, number one? And number two, even with oral, I mean, IV dosing, you avoid all of that. But with oral dosing, it is said that the body could only absorb, I think it's 500 milligrams at a time, if efficiently. And then how much, sorry?
1,200.
1,200.
Approximately.
Okay. So that changes the dynamic, because I was taught 500 milligrams is the max that can be absorbed at any point in time. Well, then that makes sense. So it's, I guess it would be like 1,200 milligrams multiple times a day to get.
You can give it about 4 times a day. You won't have any of the issues that you have.
Okay. Understood.
So fortunately, we get a lot of preparations from the pharma industry, which are chewable and all that. So while they say there's 1,000 milligrams in them, effectively there must be about 600 or 700 because of the other things that they have there. And what gets absorbed would be about 50-60% of that. So we generally, orally, I hardly put any of my patients, I don't even seriously look at oral vitamin C on the same level as IV. I give liposomal vitamin C. Yes, Dr. Zandre, liposomal vitamin C is something that I look at because it does give you, we've got some preparations available in India, which are actually imported from the US, which I can go up to about 6 grams a day in my patients, because I do a lot of cancer patients, right? So we do 75 grams a day of vitamin C in them in a single sitting. And so when they're off it, we try to put them on 6 grams as well. So yes, I do a lot of the vitamin C, but I don't give oral. Even in my COVID patients, I'm not very happy. Early stages, we have to give it because I don't need to give them IV. But as they get worse, we put them on IV.
Dr. Lenny, what about if the person, making sure that it's not being given on an empty stomach, because that also makes it worse.
Yes.
And also what you're taking it with, like things like aspirin, NSAIDs, those things that already are going to give you the heartburn, and that you make sure that you're not taking combination. I cannot tolerate Voltaren, So if I'm having vitamin C with Voltaren, I've got big problems orally. So just make sure the combinations. And the one other thing I also recommend, I'm sure Dr. Lenny as well, is foods that are high in vitamin C. So even though you're taking it orally, make sure the foods. And if we do our research, you'll know that a green bell pepper has actually more vitamin C than an orange, and a guava has more vitamin C than an orange. And I know you guys in the Caribbean have wonderful fruit there. So maybe that would be a way to increase the amount that the person gets. And also when you're sick, those kind of things are quite more palatable, especially like sour things, when you have like the taste in your mouth. So probably just get it in the other way.
Gotcha.
The other thing I'd just like to mention, Misty, is if you are having GERD and you're having bloating because of taking vitamin C, the chances are you are seriously hypoacidic. There is less acid in your stomach. And so, adding a little bit of apple cider vinegar early morning in a glass of water would kind of reduce that. Always remember
I know you're getting a little bit of a personal dynamic here. I don't do well with the apple cider vinegar.
So use lime. Use lime.
Okay.
Use lime. Use something that will give you a little bit of increased acidity. Use betaine. See, we use vitamin C with betaine to increase the acid production in most of the people who come for GERD with us.
Betaine.
Vitamin C actually increases it. So you need betaine to do that. And zinc.
And zinc, yes. Zinc. Thank you so much.
Thanks, Dr. Lenny, for that. We're going to take one more question from Manuel Gonzalez for Dr. Lenny. You can have the floor.
Dr. Lenny, thank you very much for your... the first time I heard it was wonderful, and every time I listen to you, we get the same inspiration. So it's wonderful to hear you. My question is, it's not really related to the protocol. It goes back to what you were mentioning about Goa. I know you're from Goa, and your hospitals are practically, nobody's there, nobody has COVID over there. But I was looking at the figures of Uttar Pradesh, and the same thing. The Uttar Pradesh has something like 17 cases a day in a state of 230 million. And here's my very quick question. How predominant is the use of ivermectin in Uttar Pradesh? And is it because of that ivermectin, or is it because people are just, like you were pointing out, people have become immune to it?
Okay, so let me explain. So I've spoken about Uttar Pradesh in various presentations, but they were short presentations. But let me explain this to you. How Uttar Pradesh exploded was because they had this huge religious gathering where there were more than 1 million people who had gathered in one area, right? And so it started from there. So obviously, if it started from there, it went to rural Uttar Pradesh where we don't have the numbers. Now we have a very dynamic chief minister. Maybe many of us may not agree with him, but for me, what he did as far as COVID was concerned was what every administrator in the world should have done. He thought out. He said, "I'm going to have a problem at my hands. I'm going to have a death rate at my hands. So I'm not going to listen to anybody." The Indian government, the central government, had pulled out ivermectin. He instead put it in his kits, and he distributed it not only to people who were testing positive. So if he went to a house, if the people went to a house and found that the person had tested positive, there are 5 people in that family. All 5 people got the kits. All 5 people started taking it together. And so that is how they killed it in 2.5 months. And then what happened? Slowly his vaccination was coming up. So those people who were not infected kind of took some of the vaccination, but they are still not even 50% vaccinated in that city, in that state. But they have very low levels of, and I think it is ivermectin. Second thing, Manuel, is that in India, we use ivermectin for worm infestation. And most of these states have a huge amount of kids who come for worm infestation. Adults come for it. Farmers in the fields come with issues. And that is the reason why ivermectin is easily available over the counter. You don't need a doctor's prescription for it. People can go and buy it and use it for worms. And that is what's being done. Most GPs have access to it.
Thank you. Thank you for that, Dr. Lenny. It's probably the same thing like the rest of Africa, right? Because in the rest of Africa, yesterday in our World Council meeting, somebody put up a map showing where the numbers are high at the moment, well, always at the highest. And it's in Europe, in Africa, South Africa is the highest, but the rest of Africa doesn't even have a color because of the use of ivermectin, hydroxychloroquine, maybe antiretrovirals, or the fact that they are like, we got other things to worry about, guys. COVID is one thing, but we've got like hunger and poverty. So that's what people are looking at. So thank you so much for that, Dr. Lenny. I think there's one comment in the chat, if you can just reply to that. And I know you have another engagement.
Yes. So, Dr. Marielle, so her question has been that high doses of vitamin C, such as in cancer, act as oxidants. Yes, that is how we use it in cancer. So each patient responds differently, and when that antioxidant becomes oxidant is differed from patient to patient. So anywhere between 45 grams to 70 grams at the time is oxidant. When we give 25 grams 3 times a day, there is a gap of about 4 hours at least. So then you don't have that oxidant feeling. Having said that, even if you give 10 grams, there is a transient oxidant effect. These are biooxidative therapies. Please remember that. In that oxidant effect, which vitamin C causes, it creates an antioxidant effect in the body. It actually does cause hydrogen peroxide. So normal cells will immediately up their antioxidant status and destroy the hydrogen peroxide. When it comes to vitamin C, to cancer, we increase that dose because we want a sustained period of hydrogen peroxide, which will kill the cancer cells. Normal cells will immediately destroy the hydrogen peroxide. So that is the exact mechanism how it works in cancer. And that is what we have seen as well.
Thank you. Thank you for that, Dr. Lenny. I know you've got another engagement, but before you go, I want to just let you know, our friend Omar Khan, who I also have utmost respect for, who writes beautifully, who's in Sri Lanka at the moment, the journalist that's always on our summits. He's asked me to help organize Indo-Sri Lankan African summit. So we're going to be doing that in the middle of Jan, and you're the first person I'm telling live. So we're definitely going to need you. So I'll let you know when. Thank you. So
I get a whole lot of speakers from India who have done a lot of work on this.
Perfect. So we want to do one of those, like a subcontinent mixed with Africa, and it's going to be middle of January. That's what we're going to do.
Done. Anytime.
Thank you. I really appreciate that. And thank you so much for your inspiration and for all that you are doing. May God bless you. And I'm so glad that you are in my life.
Thank you. Thank you for having me. All the best to all of you guys. Stay blessed. You guys are doing a great job fighting what is happening across the globe. Thank you.